Hello, everyone. My name is Morgan Little. I am a student at Pennsylvania College of Health Sciences in the RN to BSN program, and I will be discussing the topic of coaching and disciplining staff. As we go through the presentation, you will find some of my references in the bottom lower left-hand corner, and then at the end of the presentation, I will have a reference page for you to view as well. So I'll start by introducing the topic of coaching and disciplining staff. Coaching and disciplining are two different things, but they kind of go together when discussing this topic. They're both a means of improving an employee's job performance. The goal of coaching is to improve job performance of an employee when there's performance problems, or it can also help eliminate performance problems in the workplace. Coaching is done in short sessions, kind of one-on-one in brief sessions every day, and it kind of just helps the employee work through their problems and kind of delve into the issues that they're having. Whereas discipline, that goal is to teach new skills and also encourage the staff member to behave appropriately in the future. And I'll get more into this later, but the goal of discipline is not to punish any guilty parties. It's simply to kind of help them improve their behavior and also teach them new skills and find new ways to act appropriately in the workplace. So I'll start by talking about coaching a little more in depth here. Coaching is an everyday process of helping employees improve their work performance. It's kind of done every single day, lasting no more than 5 to 10 minutes. This person will just sit down with an employee, kind of talk to them about their issues that they're having and find alternatives to that problem. Coaches can help staff members focus on solving specific issues or conflicts that may interfere with their job satisfaction. So if someone is not happy with their job, a coach might sit down with them and help them find what's really going on and seeing if there's any alternative to that issue. And I'll talk about this topic more in the area of healthcare, in the idea of nurse managers, but a coach can be a nurse or it can be a human resources employee. It kind of just depends. Doesn't have to be your nurse manager. It can be a peer who has been assigned to coach someone, and we'll get more into that when I discuss the qualities of a person who is designated to be a coach. So one of the goals of coaching is to resolve conflict in the workplace. So coaches often help to resolve conflicts. The conflicts can be between a nurse and a nurse. It can be a nurse and a physician. It can be a nurse and a patient conflict, and various other roles. It could be between a nurse and a patient care assistant, and so on. So the coach would help the staff member by sitting down with them, helping them explore the exact problem, helping them consider alternatives to the issue, and then the ultimate goal or objective of resolving conflict is to reduce turnover from issues that can be resolved. So during this coaching session, the coach will sit down and find alternatives to the problem. So does the employee need to transfer to another floor if this is an ongoing issue, or maybe they need to find a new job if they're that unsatisfied with what they are doing. So the coach will kind of help them work through those issues and find exactly what's going on to find what they can do to solve the problem. So I just listed here some qualities of a good person who is a coach. So a coach might be designated by the nurse manager, or it could be someone that the employee kind of looks up to. Either way, a coach should be a person who is professional in the workplace, a person who is a good example of success. So you don't want someone coaching who's constantly like getting in trouble or their performance is bad as well. They're not really going to set a good example for the employee to follow. A coach should be inspiring. They should be motivating. They should also offer some tough love. So they shouldn't be afraid to kind of talk about the tough issues if the person really is having some bad behavior in the workplace. And they should also be able to promote achievement and responsibility in their peers. So those are all good things that a coach should possess. and that person will be assigned to help someone. Okay, so we'll get into the topic of discipline. So whereas coaching is kind of a short, brief sessions to help someone improve their job performance, discipline is now that's going to be an action taken by most likely the nurse manager to kind of correct an employee's bad behavior if it's an ongoing issue. So discipline is sometimes necessary, although most managers do not like it. A lot of managers dread having to discipline someone because they just don't like to handle the issue. If patient safety is an issue, discipline is always necessary, especially in healthcare. We work with patients, we work with our peers very closely, and we need to make sure that patient safety is a top priority. So if patient safety becomes an issue, discipline and disciplinary actions will need to be taken. For managers, learning how to effectively discipline an employee will reduce their hesitation to discipline in the future and also improve employee morale. So I put on here why the hesitation. So I said previously that a lot of managers dislike and kind of dread having to discipline someone. So there are several reasons that managers might hesitate to discipline. They might have had a lack of training. They might be a very new manager and not really had a lot of training from someone, and they might be kind of hesitant to actually discipline. They might rationalize their actions to avoid discipline. So for example, if an employee is constantly late every single day and the manager wants to talk to them about it, but they might just rationalize to avoid discipline. If the person is kind of getting better, they might be like, oh, they're trying to improve their job performance, so I don't really need to discipline them if they're starting to get a little bit better, when in fact they might just be hesitant to actually discipline the employee. The manager may have had previous bad experience with disciplining, and also the manager might fear that the employee will respond negatively towards the discipline. So I'll talk a little bit about progressive discipline. Basically in this, the principle is that employees should first be given a warning, most likely a verbal warning, before more severe discipline occurs. You just don't want to suddenly be like firing the person for a simple mistake. You kind of want to give them a warning and give them a chance to improve their behavior before taking severe actions of punishment. So failure to change behavior after the warning will result in increasingly severe actions for the employee, which will be taken most likely by the nurse manager. It's important in progressive discipline that you look at organization policies and procedures, and they should all be understood before implementation. You don't want to discipline somebody if they're like following the rule book. So it's important to look at your employee policy manual, your code of conduct, and just make sure that they are actually following the rules before discipline is taken. So I put on here how to discipline effectively. This is a very short list. There's a lot more, but I thought this list kind of sums it up. So it's important to know the facts before you take action. If there is a conflict between two employees, you definitely want to get both sides of the story before you discipline, because you never know which story is correct. So you want to talk to other employees who might not be involved in the issue, kind of get all sides of the story and know all of your facts before taking any disciplinary action. Do not discipline someone while you're angry. If you're like having a bad day, you don't really want, as a nurse manager, you don't want to take this out personally on someone. So don't act while you're angry. Be consistent with your discipline. So if you discipline someone for being late, we'll go back to that example. If another employee is doing the same exact thing, being late every single day, despite verbal warnings, you want to discipline them both in the same way. So you need to be consistent with your discipline. I put on here, you need to privately discipline someone. It's important to take someone aside into a confidential space. If you're a nurse manager, take them into a private room in your office, shut the door, just give them a lot of space because it might be embarrassing for them. You don't really want to discipline them out in the open in front of a group of people or their peers. Do not let the discipline become personal. This kind of goes back to do not act while you're angry. But if the manager has some personal feelings towards the employee, you don't want to let those personal feelings get in the way of your discipline and affect you in the wrong way. Do not back down when you're right. I think this one's really important to remember. So if you're looking at your policies and procedures manual and you're trying to discipline this person and you're trying to back down, it's important not to back down when you know you're correct. And like I said, always have that policies and procedures manual to back you up. And also inform human resources of the outcome of the discipline. So if the person is suspended or other disciplinary actions are taken, it's important to let the human resources person know. That way they can be involved in the discipline as well. So patient safety is important. This kind of goes back to what I was saying earlier about disciplining someone is always necessary if patient safety is an issue, if patients are put at risk. So patient safety should always be a top priority for everyone working in healthcare. Disciplinary actions should be taken when reckless behavior occurs. So if an employee is acting kind of recklessly, they come into work maybe under the influence of something, they're not acting appropriately, they're definitely putting patients at risk, and disciplinary action needs to be followed immediately in that situation. Patient safety could also be put at risk by a medication error, or if a nurse has an IV that ran dry, or they failed to act in a situation when a patient was in danger. All these situations require disciplinary action to be taken. So if safe procedures are consistently followed, working safely will become incorporated into the employee values. So it's important for managers to kind of emphasize that patient safety is key, and that's kind of what everyone is there for. So I put on here a video of discipline in action. So if you copy and paste this into your browser, you can watch this short video. It's like a little over 3 minutes, not very long. It's a pretty good example of some role play of discipline, and it also shows some progressive discipline in there as well. I thought it was really good to highlight some discipline in action. So in conclusion, let's compare here coaching versus discipline. They're both very, very similar, but coaching helps to improve employee performance. It might help reinforce positive behaviors of the employee. And like I previously stated, coaching sessions are short. They're lasting no more than 5 to 10 minutes. They could happen every day. They're just short, brief sessions to kind of explore the issues that the employee is having. And then discipline on the right-hand side there. The purpose of discipline is not to punish any guilty parties. It's to help the employee kind of fix their behavior and give them a chance to fix that behavior so no further severe action is taken. Discipline can help employees learn new skills and, like I said, change their negative behavior. And of course, discipline is necessary when workplace policy violations occur. So again, it's important to have that policies and procedures manual with you to kind of discipline that employee to back you up with some information. In closing, I listed my references here for you. Please take a look at those. And please also watch the discipline in action video if you have some time. It's a great example of some role play and some disciplining between employees and managers. Thank you all for watching my presentation.